Hello, good afternoon. We are now, isn't it? Thank you, Selina, for the introduction. Yes, my name is Rianne Toenhake. I'm an MD, but also a lifestyle expert here at OpenUp. And I'm so happy we're going to talk about this. We're going to open up the conversation about the menopause because it's often misunderstood, yes, and we don't speak that often about it, both as healthcare practitioners as also for clients. And why is it so important? First of all, let's look at some numbers. Here you see in the graph the red line. It's the labor force participation of women. And you see in the last decennia it has been grown dramatically. And in the same time, we don't talk that much yet about menopause on the work floor. First of all, we have 31% of women who do feel comfortable to talk about, which means there are many women who are not feeling comfortable talking about their signs and symptoms, showing in the impact survey of 2024. We do see that women at least have, for 55% of the women, notice negative effects on their work performances because of the menopausal symptoms. And for example, in the Netherlands, there's only 2% of the employers who have a menopausal policy. However, 5 out of 6 of the supervisors, they are open to talk about accommodations, what we can do to support the woman who's going through this phase of life in a better way. Think of flexible working hours, task flexibility, but also temperature control, more support on the health, mental and emotional level, a more comfortable clothing policy at work because of the temperature changes. There is a lot to say about it. As a medical doctor, I've seen so many patients who had problems because of this time of their life. But as a lifestyle expert, I also experienced how much benefit we can gain when we know more about it. And that's what we do here today. First of all, what is it? What happens in the body? Secondly, how can we reframe this period in life as a more positive experience? And last but not least, we wouldn't be OpenUp if we wouldn't cover lifestyle changes that can ease this phase of life. So thank you all, men, women, employers, employees. Give me a thumbs up by the emoticon in the toolbar below if you're also so happy that we have this time today to open up the conversation. Menopause, what is it? First of all, menopause is officially just one day. It's just one day after 12 months after you didn't have a period. This shows signals the end of the natural pregnancy potential, and mostly it happens around the age of 50, 51 years old. Of course, this doesn't happen all of a sudden. Yes, we first of all have the reproductive years. We see that the estrogen is still high, and then we have this humpy, bumpy roller coaster years, which we call the perimenopause, and that's going to be very important in our talk today. We have this moment in time, which is officially menopause, and from then on we talk about postmenopause. If the menopause happens before the age of 45 years old, then we talk about an early menopause. Is it before the age of 40? We talk about a premature menopause. And the last thing that happens to 1% of the women. Yes, because what is happening in the body then? We see in the childhood, we have the puberty, where the hormones are rising. The reproductive years, there's a very predictable pattern of the hormones. In our case, where we will talk about the most today is estrogen and progesterone. And then all of a sudden, they start to fluctuate a lot. Estrogen, or estradiol, how it is depicted here in this graph, with the green dotted line, will rise and go down again, and eventually it will decline. When it's high, it can cause irritability, but when it's low, then it can cause anxiety or depression. In the same time, progesterone is also declining, and progesterone is known as the calming hormone. It calms the nervous system. So when it's declining, then we see women experience more heavy periods, more migraines, sleeping problems, and that's not so much fun. So I'm curious, is someone around you, or maybe you, currently going through the perimenopause, which we also call the change? Let me know in the chat. In the meanwhile, until the answers come in, I'm gonna cover 2 topics I get asked about a lot. What, first of all, is the age? I will go through the menopause. Sorry, but there is no crystal ball. I can say when the menopause happens, but also what kind of symptoms you will experience, because there are just too many factors that are influencing this time. So what can influence is genetics, so your DNA, but also underlying conditions, so certain diseases you have right now, maybe surgery you have you had to go through, or treatment or treatments. But if you go through it early, so before the age of 45 years old, you start to have signs and symptoms, or for sure before the age of 40, then we see often other female relatives in your family experience the same. So it can be useful to talk about it with your mother, your aunt, to get the conversation also in your private life going. I see in the chat many yeses, unfortunately, me too. Yeah, all right, let's continue. Second topic I get asked about a lot, blood test. Can I have a blood test to diagnose my perimenopause or menopause? Sorry, but there is no, blood tests don't have a role for this purpose. They cannot say that you're still fertile, if you need contraception, or if you need hormone replacement therapy. Of course, sometimes we do blood tests to rule out any other conditions, for example, a thyroid condition, or we do hormone tests in certain cases if you're under 45 years old and you experience severe symptoms, or if you start hormone replacement therapy and we do the follow-up, then it can be useful to check in with your hormones. And I will soon cover the signs and symptoms that can be happening during this phase of life. And I'm curious about the knowledge you have already. So what are mostly the first signs of the change? And a poll will be shown. Yes, here's the poll. So in the same time, I will continue with the next slide, and then I will look to your answers on the poll. Because this perimenopause, there is a big variety of symptoms beyond the well-known hot flushes, night sweats, and the changes on the menstrual cycle. Why? Because these 2 hormones we talk about today, estrogen and progesterone, they travel through the body, and all different kind of cells do have receptors to react on these hormones. So when the hormones change, we have effects throughout the whole body. And it's crucial to understand these signs and symptoms to navigate this phase of life in a better way. Let me take a look at the answers of the poll. Yes, okay, I'm happy to see that D is the correct answer. The first sign we can get is just changes in the menstrual cycle. It can become lighter, shorter, longer, lighter bleeding, heavier bleeding, but also increased PMS symptoms. Let's have a big dive into all the symptoms. Are you ready to journey with me? We have, like I said, changes in the menstrual cycle. Irregular, lighter, heavier before they fully stop. We do also see a reduced sex drive, more often than a sex drive that is heightened. Why? Because of the estrogen, it declines, and estrogen takes care of the arousal. and the lubrication. And if it's less, then we have a less arousal, also impaired orgasms. Do that together with the vaginal dryness that can cause painful sex, and intimacy can become challenging. Then we have, of course, the hot flushes, the night sweats, and breast pain. So what does happen? The hot flush, it is because of a change in our central temperature center. It is an intense hot feeling from the inside out, sometimes started with a cold feeling, heart palpitations, or dizziness, and they can take seconds, but up to an hour, and they can happen once a month, but maybe a couple of times a day. Many women, it takes more or less 4 years, but there are also women where it takes longer than a decade. This is something to really take care of. We have the breast changes, which means that the breast gets less elastic and less hydrated, so they start to sag. We also have more common lumps and also breast pain. And then there's this big topic of mental, emotional signs and symptoms. So the estrogen has an effect on the serotonin, which is one of our happiness hormones. So more easily we experience irritability, low self-esteem, and poor motivation. So one of my clients said, "I'm just feeling flat as a pancake." Women who have had a postnatal depression or an intense premenstrual symptoms, they are more likely to experience this. At the same time, we can experience the brain fog, that you feel flat as a blank sheet of paper, another client said. These are very tiring and difficult symptoms, and it's worth it to talk about it on the work floor, but also at home, how to deal with your tasks and make changes there. Weight gain. Because of the changes in estrogen, our body starts to distribute the fat in a different way, that the fat is more easily accumulated around the middle. And if you add to this painful joints, tiredness, it's super difficult to do your exercise. And this doesn't help, of course, with the weight gain that is already happening because of hormonal factors. Then we have urinary and bladder issues, because estrogen is super important for a healthy pelvic floor and for a healthy lining of the urethra and the bladder. So what happens? The pelvic floor gets weaker. And what does this give? More embarrassing signs and symptoms like leaking through when you're coughing or sneezing. It can give constipation, or more often an urge to go to the toilet. In the same time, we see that the changes on the vaginal lining can give you more easily urinary tract infections, or thrush, or itchiness. It's no nice feelings. Then we have the joint pains, because estrogen is a lubrication for the joints. So less estrogen gives you more easily joint pains and also muscle stiffness. On the long term, we see that the bones get more weak when we have less estrogen. And this we call osteoporosis, and I will talk about it with you in a bit. Last but not least, our hair, nails and skin get more thinner, more brittle, and less hydrated. We see women have more often acne, which they didn't have for a long time, or they're more sensitive to the sun. And the senses can change, like the smelling, the taste. I see women who have a burning sensation in their mouth or dry eyes. So as you see, like, it's a big pile of different signs and symptoms. So I'm curious for one, what is bothering you the most in your current life? We have a poll for this, and I will ask you to fill in the poll, and I'm just curious what's going on your side. In the same time, I will continue with our next slide, because this was already a lot, but it's not done yet, because there's something I really want to talk with you about, and these are the long-term conditions. Vaginal dryness, osteoporosis, and cardiovascular disease. Vaginal dryness, why is this happening? Like I said, the estrogen is super important for the vaginal lining, and we get vaginal atrophy, as we call it. This gives dryness, itching, and more easily inflammation, and more easily painful sex. We are more susceptible for thrush. And luckily, there are pelvic floor exercises that can help to support you when you have a lot of vaginal dryness. But unfortunately, in many cases, it's not like with the hot flushes that they go over more often, but it can be that the vaginal dryness stays. And for these women, we do need to use locally estrogen to improve these complaints. Then we have the osteoporosis. This is the weakening of the bones, and women in general are more prone to have this because they live longer and they have smaller bones. So what happens from the menopause onwards is that in 5 years of time, 10% of the bone mass disappears. That's a lot. And the bad thing on this side is that we cannot see it from the outside. Many times there is a fracture from a very stupid little fall that we notice, oh, maybe there's osteoporosis going on. My mother, unfortunately, had this to happen. What can you do? Luckily, movement and nutrition can help a lot, and I will go into that in a bit. And last but not least, the cardiovascular disease. Estrogen is super important to keep your cholesterol and your blood pressure healthy. So decline of estrogen will make you more prone for heart disease. And again, there is also good news on this side. We have stress management, nutrition, and movement that are a very good support to reduce this risk. Let me see the poll. Can I see the answers of the poll? Oh, that's quite balanced. Again, also with our Dutch masterclass, brain fog and poor concentration is something women are bothering a lot. Is bothering a lot. And again, the mood changes. And we also have not applicable, so maybe there are many people who are not yet in the perimenopause, or maybe also men present, which I really appreciate. Yes, let's take a look further. How can we reframe this phase of life? Like I said, this was more or less a lot of negativity. And also in our Western society, we are more eager to look at those transitions as something that we lose. We lose our looks, we lose our libido, we lose cognitive functions. But what if we can turn this around and see it as a phase of life that's an opportunity for personal growth? Studies also show women who are able to reframe this period of life, they have less negative emotions. They show more and higher score on quality of life. And it's a time of reinvention. And how can you do this? How can you do this reframing? I don't say it's easy, but it's super interesting to think from this perspective. First of all, physically. So think of your body as a great wonder. You know, it's able to adapt to the changes on the hormonal level. It gives signs and signals where you can work with and not against. So work with the symptoms you get from your body, the signals. For example, hot flushes often increase when there is a lot of stress. So is this something that's bothering you a lot? How can I see to prioritize? How can I take more care of myself? Focus on this one thing today instead of this big to-do list of all the things you want to do. It's just a small example. Secondly, we have the creativity and the wisdom. They flourish with age. Many women are ready to start teaching, writing, or do any other creative endeavor. I heard also many clients who say things like, I don't care anymore about what anyone else thinks. I mean, that's amazing. You can be a role model for the younger generations. Again, we have here cultural differences. Studies show that up to 40% of the women look at the menopause as something positive, something where they reach wisdom and more status. How can we do that as well? I mean, celebrate this phase of life. Look at all the things you accomplished, and also celebrate all the new freedoms you have. No menstruation anymore, no contraception. I mean, hooray! Include in this celebration not only yourself, but your friends, your family, and let it be a time to foster community and personal growth. Yes, here we are, lifestyle changes. The other 3 topics I'm not going to discuss today, but there are also entrances to make your own toolkit. Mind-body practices, cognitive behavioral therapy, and hormonal and non-hormonal treatments on prescription. The last topic we go into in our course, which will be released in the end of the month, and that's a big file of a lot of information about this last topic. Today we're going to look at the lifestyle changes. Keep on moving, first of all. And I know maybe you shoot me when you think of this, because you're not ready to move, you're tired, you didn't sleep, maybe even a low self-esteem of all the changes you're going through. But I'm going to show you why it is as important as ever. First of all, it will help to keep your bones healthy. Movement gives an impulse to your bones to make new bone mass. It will keep your muscles healthy, so there's a reduction of the risk to fall. And it will improve your cardiovascular risk. Estrogen is not doing it anymore, so movement can lower your cholesterol and lower your blood pressure. Then we have the improvement of mood. Yeah, I know it myself. I mean, movement gives me a lot of endorphins. I hope you know this as well. And last but not least, of course, it can combat increased fat distribution. So what can you do? Do things with your own body, like cardiovascular exercise, but also Pilates, yoga. And you can do strength training, especially in this phase of your life. Use your muscles. The higher the load, the better the outcome. But of course, start small, find a buddy, do things you like. And this will give you a lot of benefits. What can you do on your diet? I mean, it's the same as with movement. You're tired, you have mood changes. It's so easy to grab for the sugary snack, but there are also reasons to look at some other things in your diet. Look for vitamin D and calcium to support your bone health. Vitamin D, of course, through the sunlight, oily fish, eggs, and supplements. Calcium we find in leafy greens, nuts, bony fish, dairy, and tofu. The balancing of your blood sugar is super important to improve your mood, because if the blood sugars are going up and down, then our hormones will do too, and this will give you more mood changes. But also in the long term, a stable blood sugar gives you a smaller risk on cardiovascular diseases. And think of whole grains instead of sugary snacks, and of course increase the protein, which is also amazing for your muscles. For your gut, it is very good to implement everyday prebiotics and probiotics. And I already mentioned it, supplements. So first of all, there's nothing that can rule out a good diet with a lot of variety, but in certain cases, this can be useful. For sure, vitamin D, especially where you're not so often outside, if you have a lot of clothes covering your skin, or if you're from African, Afro-Caribbean, or South Asian backgrounds. Secondly, omega-3 you find in fatty fish, but it can be useful to use supplements to improve your cardiovascular risk and your mood. And last but not least, magnesium. Magnesium we find in our food, yes, for example in leafy greens, but it can also be sometimes that the uptake is not so well. For example, when there's caffeine intake, stress, or certain medications. And this can be a reason to do take magnesium, because it's an important player to calm the nervous system, to have a good sleep, to improve the muscle stiffness, and also improve anxiety symptoms. Bedroom, where shall we think of? support your internal clock to go to bed more or less in the same hour. You go in and out in the bed in the evenings and in the mornings. Comfort, ditch the heavy duvet and choose a lighter one. Go for natural fabrics like bamboo or cotton. And sleep in a cool room, 19.5 Celsius. Of course, the blue light, it's not good for the production of melatonin in the evening, the sleeping hormone. And do you have a mind who's racing? I mean, I have it also. Then start to write either a to-do list or maybe just expressive writing where you just express everything that's present. And it shouldn't be nice or beautiful, but just at least 3 pages of expressive writing can help to quiet the mind. Of course, there's a big amount of relaxation techniques, but think of a good night of sleep starts in the morning. So see that you have moments, they shouldn't be long, but just moments in your day of deep rest, maybe 5 minutes, 10 minutes, with a meditation, with a walk in silence, no talking, see what works for you. And managing the hot flushes, of course, the triggers. Spicy food, heavy meals, hot drinks, caffeine, nicotine, low blood sugar, important one, and alcohol can induce hot flushes. So please focus on these triggers, especially in the evening, so it doesn't disturb your night. Stay cool, have cool drinks, fans, natural fibers like the cotton and the bamboo. Also have a spare handy of pajamas ready next to your bed when you might be waking up by a hot flush, and layer your clothing during the day so you easily can adapt to your own temperature. And if you're doing that presentation, if you are running that board meeting and you do have a hot flush, please just embrace it. Transform this phase of life, reframe it, own it. It happens. That's life. So we came to the end of this presentation. Let me know in the chat, what are the key points of today that you take away for yourself? And what would you change perhaps for the future? I'm super curious to read from you, and soon we will start with the Q&A. Thank you for your time and your attention.
Thank you very much, Rianne, for all these insights. Was very insightful. And if you were like me and wanted to write down all the tips that Rianne was giving to not forget them, fear not. We have a handout that you can download. It's a PDF, and we'll upload it under apps, bottom right, so that you can take away some of this information and don't need to remember it all right now. Thank you very much. There is a lot of discussion in society currently, more and more, which I'm very grateful for. Also, generally about menstrual health, we have a group session, an interactive group session with about 30 people, which we host at openup.com/spaces. So please sign up to them. They're called Menstrual Health and Emotional Wellbeing. That also might be interesting to those listening. And you asked at the end, what is your biggest takeaway? What are you going to change a little bit? I think the reframing for me around working with one's symptoms rather than against, for me, is really critical. Somehow we've also been brought up of sort of, okay, what happens every month? And you just, I don't know, you kind of just deal with it, right, and carry on as normal. But by the sounds of things, that's very hard to do in menopause. So we also need to work with it rather than try and resist. So that's something that I'm going to try and figure out how I'm going to put that into practice, along with eating green leafy vegetables. I don't know why they should be like framed and the crown should go on them in the supermarket of eat me.
Yes,
it seems to help with so many things.
Yeah.
But let's dive into the Q&A. So firstly, from Ole, I hope I pronounced your name correctly. What can we do if we haven't started menopause yet in order to ease things in that sense a little bit preventatively? What would you suggest?
Yeah. So I hope I covered some of those suggestions in the masterclass. For this, I would refer to the lifestyle changes, I mean, strength training, of the options I gave for the nutritions are super important. And to check in with your own stress management. I also don't know if she already has certain signs or signals. Of course, then you can specify what would be even more useful for you to do. And like you said, I mean, it's easy to say to work with your body, but if you have done it in a certain way for 40 years and then your body needs something else, it's a hell of a job to figure out what works. And sometimes also we have blind spots that we didn't think of it something to add that to our routine. So,
Yeah. Okay. So take note of the handout, I would say.
Yes, for sure.
And the tips there. Thank you. Anna is asking that she hears a lot about how our mother's side of our family history, as you mentioned how that can impact how we might experience it, what the family history has been from the mother's side. But does our paternal side also influence how we might go through the menopause?
Like, in general, I don't know specific studies on this, but I mean, our father gave us our X chromosome.
Right.
So that is the chromosome. 2 X's make a female, one who's born as a female. So from that perspective, I ask my clients to look both at the mother and the father's sides.
Okay.
And yes, we have been in the belly of our mother, and our mother has been in the belly of our grandmother from the mother's side. So from that perspective, there is a bigger influence, but there's still also genetic material and lineage coming from the other side.
Yeah. Okay. So worth opening up the conversation on both sides. Maisie is wondering talking about opening up the conversation, how can we make the men around us, and a big thumbs up to any who might be listening today, how can we make the men around us aware of all of this? We've only just now started really getting the conversation going as women. What can we do to open up the conversation also for men?
Yeah, I mean, be creative, I would say. Be creative, both in your private settings as in your own work, on the work floor. First of all, it can be useful, of course, to start a conversation with your female relatives or colleagues, but then also to be creative. Did they ever heard of it? Is someone around there in their private setting going through it? What do they know about it? I mean, it starts all with small little baby steps. It's the same with the menstrual cycle. There also was like, this is happening.
Right.
And so it also needs time to land. And yes, we cannot make a sprint out of this. It takes little steps. And maybe, for example, funny metaphors like it's the second puberty, but it's just working the other way around. To just let them understand what's going on, you know?
Yeah, to lighten it up a little bit.
Exactly. And the second thing to lighten it up is that it is something that has a beginning but also an end. So if they have a spouse at home who is struggling a lot with it, I mean, for most women, it's not something that takes forever. So the most of these signs and symptoms, they will ease for sure after 4 to 8 years. I mean, that's a long time, but it's always good to look to the positive things. Yeah,
exactly. And that craft that went all over the place for very many years, it does stabilize. So that perspective can also help. Yeah. It's true. I think all of us need to start the conversation. Yeah. Absolutely. A question from Irvan. What are the things that people around us or around women going through menopause can do to support the transition or changes?
Oh, yes, I love this question. I mean, in the past we lived in a tribe, so then there was more awareness around this. Yeah, okay, it's cliche, but it starts with the conversation. And get more clear on the signs and symptoms one is encountering. I mean, if the brain fog is a big thing, okay, both in our private settings and when we're on the work floor. So, okay, what is challenging us? Certain moments of the day that are more challenging. How can we make the tasks more flexible? What do you need? Is it helpful, for example, during a meeting that you have the option to be for 10 minutes out, which we might think of something now it's strange to do, but if this is an option and it's not a big threshold to do anymore, then it's more easily also to actually do it in a moment when you need it as a woman. So the conversation is super important. Specify on the signs and symptoms someone is going through. Now I gave the example of the brain fog, but it can be other changes like sleep problems. Okay, does it help to change our important meetings to the afternoon when that we have in the morning flexible working hours? Be creative.
Mm-hmm.
Yeah.
But there's also something about, I think, in a society where the conversation is opening up, but it's not there, it's not fully open yet, right?
Yes.
If we're all honest about it. And there might be a bit of, one might feel a bit embarrassed. If I talk for myself, I can sometimes feel a bit embarrassed to sort of bring it up, certainly in a work setting.
Mm-hmm.
What helps me a little bit is thinking I have 3 daughters.
Yeah.
So I think a little bit, okay, well, anything that I can do to sort of break down the barriers will help for the next generation, even though it might be embarrassing for me. But how to bring it up at work? Do you just sit with your manager and talk about it? Like how can people start that conversation at work?
I think I first of all want to say I really love to internally think of your daughters, you know, like to open up the barricade for them, to have your internal motivation, so to say.
Yeah.
I mean, a manager, HR, the interesting departments to talk about facilities, options, and I mean. Just think of maybe having a poster somewhere. I mean, it's so easy of this hormonal roller coaster. Maybe make a little joke about it. What do you see here? I mean, this is the life of someone who's born as a female.
Right.
Just to get and and the entrance is a physiology. So, but this talk is of course also an opening up. And to make it personal. I think it's important to make it personal, to get more clear on your own experiences, maybe from your mother, your sister, a colleague, to make it personal, to make it small. Now we tend to make it as something super big and a taboo, but make it small. Everyone has someone, at least, who has gone through it, and maybe this person has gone through it super easily. That's also nice examples.
Yeah, exactly.
We don't only need to talk about the worst things, of course, happening, but make it personal. Yeah, make it close by.
Yeah. Okay, I listened to a podcast the other day actually about menopause, and it was there was a man being interviewing, and I thought the questions there were super interesting. So I was like, I'm gonna get my husband to listen to that. Anyway, that as a side note.
Yeah.
Paola asks, what you would recommend to improve the mood swings? You mentioned that can, of course, be part of this phase, is the mood swings, like the lack of motivation, the low energy. She, by the way, got her thyroid checked and they resulted negative, which I'm assuming means the thyroid was okay.
Exactly.
So her biggest problem is really the mood swings, motivation, low energy. What can she do there?
For clients who struggle a lot with these signs and symptoms, I really try to bulk life down in small pieces, to really go for this little small thing you do enjoy, to get more mindful about those little small things. And yes, this asks also adaptation, because beforehand it was so easy to feel joy, or it was so easy to feel motivated to do something. Okay. But break it down. Okay, I'm not able to do a jogging of half an hour, but let's focus on 2 minutes. Hooray, I did it. Fuck, celebrate that as well. Or you feel just like break things down, make it small, because otherwise you're going to push yourself to a higher threshold of joy or performances, which is too high, so it's more easily for the internal critic to come in again and say how bad you are and to lower your self-esteem.
Yeah.
Make it small.
Make it small.
It's super boring.
Okay. Okay, that's good.
But it will give you a small celebration because we want to have little winning experiences again, which will boost your self-esteem as well. But it really asks to make things small.
And to not compare yourself to 10 years ago when maybe the half hour was possible.
Yeah.
Yeah, exactly, because that's...
Yes, and that's of course also, in the end, we are all valuable and everything is fine. But we are used to a life where we can do all the things and we compare each other and we want more and better and further. That is a more like philosophical way to approach is to go to the good things that are still there. To go to your value you still have. And from there on make steps again. And from there on find new ways. And that can be different. You're not the one anymore 5 years ago.
No.
And exactly. Life will always change.
Yeah. Indeed, it's the only constant, right? Yeah.
Yes.
So make it small to experience those success feelings. We do all need that. That doesn't change. So we try and do things to prevent experiencing joint problems and stiffness. And Cornelie is wondering if you do then experience these joint issues and stiffness, what can one do to alleviate these symptoms?
Of course, when a client has this, it's always specific. We're going to look at what kind of joint pains when they come up, what kind of exercise you already do. Because perhaps you want to do more weight-bearing things like swimming, for example, and later on do some more strength training because perhaps you did too much. So that's specific. And be creative on this, and not because you have been running all your life. It can still be interesting to change sports you've done to also challenge your body in a new way. Yes. If it's something that is bothering a lot, then there can come in a certain point a step to hormonal replacement therapy. And this is again, how do you make that choice? It depends on the severity of the symptoms and what you already tried on the lifestyle side of the coin.
Yeah, okay. Clear, and there's a course coming about that, going into that in depth. And it's already time for our last question. Time flies. Yes. From Rafaela. How to ask the doctor about HRT if it's not possible to have the blood test. Because you mentioned that wasn't a reliable diagnosis.
Exactly. So mostly what I just mentioned, we start HRT when things are in a certain severity, which is always in constant with the patient and the medical doctor in the most ideal situation. Yes, I do have clients who find a blocked door, so to say, at their GP, for example. What can help? We talk about this in the course, to use the green climacteric scale, which is a questionnaire that's also used by medical doctors, which covers all these symptoms, so it gets a clearer picture on everything you go through. Maybe hot flushes are in the foreground, but hey, this and this and this is also happening. So it makes it gives more reasons to start HRT, for example. And by that, you do talk the language of the GP, because they don't have so much time. Sometimes they don't have all the knowledge. Of course, when you have the ability to talk with one of our lifestyle experts, then it can also help to get yourself more informed how to approach a healthcare practitioner. And in certain countries, you also have nurses who are specialized in the menopause, and they can also give you good recommendations to like a letter for the GP or the gynecologist to get that conversation going. Yeah, because also as healthcare practitioners, there is a big gap around this topic, and some are very informed and some are little informed. So we're working on that. But we said already a couple of baby steps.
Yeah, exactly. A couple of baby steps. And what was the scale called again?
green climacteric scale.
Green climacteric scale, presumably findable online for people.
Yes, exactly.
Yeah. Okay, well, thank you very much, Rianne, for answering the questions. Thanks, everybody, for joining our masterclass today. We love giving masterclasses. Our next one is on the 29th of November about embracing constructive conflict, getting comfortable with disagreement. So sign up there on openup.com/spaces and look forward to seeing you there. And for now, have a good day. Thank you.
Bye.